is just a huge honor for me today to be podcast interviewing a legend in implantology, Louie Al-Faraje. He is just crushing it. He literally defined and authored the art of oral implantology. As a leading authority, he created many classifications and techniques, the standards by which oral implantology surgical procedures can be successfully performed. His name has become synonymous with results-oriented oral implantology treatments around the world. A highly experienced clinician, educator, and innovator, he continually advances the protocols for oral implantology surgical treatments. His California Implant Institute in San Diego, California, utilizes today's most innovative and effective clinical solutions to create and maintain optimum oral health using dental implants and bone grafting procedures. Additionally, he is board certified, practicing oral implantologist in San Diego, California, as well as an author and educator who presented hundreds of lectures and trained hundreds of dentists throughout the world. He received his medical education at Kiev Medical School, Faculty of Stomatology, and followed by a postdoctoral training at Loma Linda University in California. He is the author of a best-selling textbook, Surgical Complications in Oral Implantology, published by Quintessence and available in 7 languages, Oral Implantology Surgical Procedures Checklist, a surgical and radiological anatomy for oral implantology, and is on the editorial board of the Journal of Oral Implantology. You've actually written 4 textbooks, haven't you?
Yes, so the 4th one you did not name. It's called Oral Implantology Review, a preparation to pass the board exam in oral implantology.
So, man, how do you have the discipline to write 4 textbooks? I mean, most people, maybe they'll write, you know what, maybe 1 out of 10,000 will write 1. How did you have the discipline to write 4 textbooks?
Well, simply these topics are missing from the oral implantology library, if you will. And since I am in the education business, if you will, so I have the material and I have the idea. And of course, you have to put quite a bit of time behind the computer. So it is roughly 2,000 hours per publication. So you just have to sleep 4 hours a day for a while.
So are you one of those guys who doesn't sleep much?
I sleep 6 hours a day.
That's sleep 6?
Plenty for me.
Yeah. So
yeah, 6 hours.
So I want to start off with this. So so last week, the United States just graduated 6,000 dental students from 56 schools, and every one of them said the same thing. We didn't place 1 implant in dental school. How do you go from, I just walked out of school and I've never placed 1, to where you are? You've placed like 4,000 implants and wrote 4 textbooks. How does she go from 0 to 1? What advice would you give her if that was your daughter walking out of dental school?
Well, first of all, you need to have enough didactic knowledge, because there are some live patient hands-on courses available, which is fantastic, because when I started in '95, there was no live patient hands-on courses. So you really had to start on your own patients, hopefully with a supervision from the sales representative or a friend who might not have more experience than you. But nowadays, doctors who are making entry to implant dentistry are lucky, because there is plenty of good courses available for the didactic knowledge, and a few courses available where you have the opportunity to place implants on live patients under supervision. So the way to go is to respect the basic sciences, review anatomy, and have a good base on the surgical principles, and then have enough CE courses, and then attend enough hands-on live patient courses, so the learning curve is as short as possible when you do the procedures on your own patients. So there's no way to avoid learning curve, as you know, but with more courses, with more hands-on training, the learning curve would be quite shorter.
You know, one of the differences between baby boomers and millennials is, I think the lowest cost, highest quality, faster, easiest, lowest cost way to learn is a textbook. You've written 4 of them. And it seems like today so many people don't read textbooks. They just fly across the country, spend lots of money in a course, and drive back home. And like I say, I'll never forget going to Carl Misch in like I think it was like 1990, and people were all asking all these questions. I'm like, dude, that was in the first chapter of his book. I read the entire book like a novel before I came down here. And hell, if anything, buy the textbook, at least read it on the plane flight to the course. But it just seems like it's just I mean, you spent 2,000 hours writing a book, so it's all there, it's succinct, it's perfect. I just think it's the lowest cost way to learn all the didactic knowledge of anything is a textbook. Do you think us 50-year-old plus guys read more textbooks than the 30 and under millennials?
Yes, but what you were talking about was taken in consideration in my books, and if you look how I structured my books, for example, the first one, surgical complications in oral implantology. So the book is made, covers, if you will, actually 75 complications. And each complication is fairly separate from the other complications. And each complication is anywhere from 1 to 3 or 4 pages. So it's very easy read. And literally every 1 to 4 pages are totally separate, I mean, in a way, from the rest of the complications. And each complication, we discuss how to prevent it first, because it would be easy to prevent the complication from happening rather than, deal with it. But then if it happens, we talk about how to treat it and how to, prevent it from happening. So, it's very easy read. And for those who want to read very quickly, you will go to that complication, and from 1 to 4 pages, you will have a very thorough, in my opinion, coverage on it. The same thing with the anatomy. So we have roughly 25 anatomic landmarks that we need to be aware of and avoid when doing surgical implant dentistry. And, it's one anatomic landmark at a time, and it covers we have radiographic images of this anatomic landmark, most of them, and then we have very good illustrations, clinical cases, clinical pictures, and we have also cadaver shots. So most anatomic landmarks are covered from 4 angles. And again, it's a very easy read because you have around 20 surgical or anatomic landmarks, and you can do one at a time. And you should have very good, thorough anatomic knowledge, because it's a basis for clinical implant dentistry. And so it was taking in consideration the fact that people these days want information very quick and in very easy format. So I think all my books deliver the topics that they cover in very easy, quick.
I know everybody is commuting to work right now, and it's hard to take notes. So what I do to make them find you easier is I retweet your last Twitter. So you're at Louie Al-Faraje. So I just retweeted you to my 21,000 Twitter followers. And I'm taking Twitter more seriously since now that I realize you can become the President of the United States just if you have 5 million followers. So if my homies go to implanteducation.net, what are they going to find on that website?
So we've been giving seminars since 2002. Over 2,000 dentists took one or more of my seminars. So we have around 8 or 9 different courses, and all of them, almost all of them, a week long. We have didactic courses in San Diego, and we have live patient surgical externships, if you will, in Rosarito, Mexico, only 30 miles south of the U.S.-Mexican border. The reason we do it in Mexico because...
From what U.S. city?
From San Diego.
Okay, so it's by Tijuana then.
It's like 30 miles south of Tijuana. Tijuana is right on the border.
Okay, so 30 miles south of Tijuana.
Yes.
My
It's
favorite
called
city on
Rosarito.
earth.
What is it?
Tijuana is my favorite city on earth. You can get in more trouble in Tijuana in one night. Yeah, I don't know where else you could go in the world to get in that much trouble. That city is a blast. So it's 30 miles south of Tijuana is your hands-on surgical courses.
Yes, we have a whole building, freestanding, in a nice, very nice area, and right on the beach in a nice gated community. And we have three different courses that we provide, each of them 6 days long. We have implant placement seminar, we have bone grafting seminar or course, if you will, and we have all on four / full arch immediate loading seminar. So most doctors take all three. Some of them already experienced, they take only the bone grafting one or only the all on four, immediate loading full arch course. And we have, again, many different courses in San Diego, from oral sedation to CADCAM full week, to advanced prosthodontics also full week, and our flagship, the fellowship program, 3 sessions, 6 days each. So you can go as far as you want with the California Implant Institute in implant education.
Well, my number one fantasy right now would be to have you make a 1 hour online course, kind of summarizing a week-long course. I mean, because it's a I think that would be amazing, and also in your online course to talk about which textbook would be the best didactic preparation, so that when you go there, you're not the one guy raising your hand saying, asking 36 questions that everyone else knows. But man, that's amazing. So your 3 hands-on courses: implant placement, bone grafting, all in 4. You said that's 6 days long. What is that, Monday through Saturday?
On Monday, we take them from San Diego to our clinic in Rosarito, Mexico. It's around 1 hour drive on a nice bus. And then we tour the clinic. We have a couple of hours lecture on Monday. We get dinner. And then the actual surgical training starts Tuesday morning. And Tuesday, Wednesday, Thursday, Friday, full day, Saturday, for 5 days. Usually we start at 8 in the morning and we're not done until 9 p.m. And we do roughly 150 to 180 implants every program in the implant placement course. For the bone grafting course, each doctor is guaranteed 4 bone grafting surgeries. And of course, doctors are divided in groups of 2. So when a doctor doing the work, another doctor is assisting. So you have double the exposure in any of the courses you attend. And then we have the all-on-4 course, where you do 2 full arches with the restorative phase of implant dentistry in that particular course. So you should be ready to provide these services to your patients when you go back to your offices with the shortest possible. We are providing also great service to our patients. We're giving them their 3rd set of teeth. So it is definitely the highest level of dentistry you can provide, with my all due respect to crowns and fillings and dentures and all that stuff. But you are providing a very high level of service to patients who already lost teeth, and partially edentulous or fully edentulous. And implant dentistry is very predictable. And if you follow the rules and you do the procedures to those patients who are candidate for those procedures, it's extremely predictable and very good profit margin. Again, we have to make sure we make enough money so our offices stay open and we can help more people. It's a fantastic thing, and it's considering what is the tuition these days for dental schools. I don't know how you can make it without offering implant dentistry services in your office these days. I don't think you can survive with $500,000 tuition doing only crown and bridge work. So I think implant dentistry is is a win-win for the doctor and the patient. We are doing implants. We're stopping the bone loss after the tooth loss, and at the same time, it will enable you to, pay the crazy overhead that you have these days, from the cost of starting a practice to the tuition, quite faster than without implant dentistry.
Well, when you go around the world, I mean, when you go to when you lecture in Tokyo, Paris, and London, me and Ryan lectured there last year. I mean, the governments are only paying $100 for a molar root canal. So when you go around the world, in the United States, PPOs have lowered the fees about 40%. So when you go into procedures like implants and Invisalign, where a government agency or a PPO isn't setting the fee, you can have really nice profit margins. So a lot of dental offices around the world, the reason they're profitable is because they might pull out an implant case and an Invisalign case out of their NHS population pool or their PPO pool every week, and it's those high margin procedures that are profitable that are paying the bills. How much money does each week cost for these 3 hand-on surgeries? 1 week implant placement, 1 week bone grafting, 1 week all on 4. What is the cost of all that?
So each course is $12,900.
And do you offer financing for dentists?
We do through the lending club, and they can apply through our website.
So you can apply that through the lending club.
Yes.
Nice. So then those are the 3 hands-on, an hour south of San Diego. But then you said in San Diego you have 3 didactic courses, oral sedation, CADCAM, advanced prosthodontics. Those are 3 separate courses.
Well, we have those 3, and we have the annual fellowship, which is also a 3 weeks program.
A 3-week.
So we have around 6 weeks. Yes. So we have a fellowship program, 3 sessions, full week each, 6 days again each, and then we have the oral sedation 3-day course, and we have CAD/CAM 5-day course, and we have advanced prosthodontics 5-day course.
And so when you talk about oral sedation, is that what is the basic of the oral sedation? Nitrous oxide and pharmacology?
Yes, and oral sedation, the halcyon in mainly. So that's that we provide at the institute. I do not speak at that course, and they do the. We have live patient demonstration that is mandatory to do, and it is a certification course, so you can apply. Or I think we apply for you, and we get the oral sedation permit for you with this course.
And what is the 5-day CAD/CAM on? Is that chairside milling for crown and bridge or restoring implants?
So side chair milling for implant crown and bridge for full day, but we walk you from the digital smile design on day 1 to computer guided implant treatment planning, to the surgical execution of implant placement using computer generated surgical stents, and then 2 days of covering the lab portion, if you will, of implant restorations. So 5 days walking you through the digital workflow for in implant dentistry, from smile design to restoration, fabrication, and delivery, but all using the CAD/CAM technology.
And what type of CAD/CAM milling machine do you recommend, use, teach with?
Zirconzan. It's an Italian machine, and I think it's the industry standard, and that's what we covered at the course.
Spell it again.
Zirconzan. So ZIR.
ZIR.
KONZAN.
Zirconzan. And where are they out of?
Well, they're an Italian company, but they have many locations in the U.S.
So is it bit large enough to mill a complete zirconia all on four roundhouse?
Yes, it is. Again, the spelling is Zirkonzan. Zirkonzan.
I
And
found it. I will for my homies listen to this. They got a Twitter button on their site. I'll retweet that so they can don't have to remember how to. So they are at ZIRKONZAHN World. And so yes, they are out of do these uniforms look familiar? Some of you? Yes, it is. New time. What would be the best? I'll just retweet their last tweet. So how many so tell us about the that CADCAM, because in America I would say the number one selling brand was a CADCAM was Sirona, Dentsply Sirona, and probably number two was E4D Plan Mecca. But do you kind of think that was for mostly a smaller single unit crown, and the
yes,
next generation of CAD/CAM will be for bridges and full arches?
that's right. So Zirkonzan is affordable enough to have it in the office, to be owned by dentists. If you're doing, maybe 10 to 15 cases a month. It is a higher level than what Sirona can do. Sirona is a great machine, but Zirkonzan and the desktop scanners usually are for bigger cases, and they do a better job than those who are designed for intraoral single, or small multi-unit span bridges.
Nice. And how much does that machine cost?
Well, they have different models, around 100.
So 100,000.
Yes.
So it can do everything really Sirona can do, and an E4D and more.
Absolutely. It can do everything those machines can do and more.
Wow. I wish you'd make an online course for that too. I just think that would be amazing. Okay, I've never even heard of them before. So think how many people on Dentaltown have never even heard of this. Any chance you'd make us an online course on just the CAD/CAM too?
Yes, absolutely. Would love to.
Because you have so much free time now that you're not writing a textbook right now. You have 2,000 hours of free time because you're not writing your fifth book.
That's right.
Oh my gosh, that is amazing. And as far as your advanced prosthodontics course, most people say that implantology is really a prosthetics procedure with a small surgical component. It's all driven by the prosthesis. Do you agree with that?
I do not agree with that.
You do not agree with that?
I do not agree with that. I think implant dentistry is exactly 50% surgical component and 50% prosthetic components, because you design the prosthesis for the patient. But then if the bone is, if the patient does not qualify because of his bone to what you're trying to accomplish, then we're back to square one. So my technique of doing treatment planning is to start with the CT scan, and this is how we do the treatment planning, and this is how we teach to do comprehensive treatment planning. We start with the 3D CT scan to look for certain things like the available height and width of alveolar bone for implant placement, bone density, certain anatomic landmarks, pathologies, and then we do clinical evaluation for the patient's smile, and from how much he shows incisal display and repose, in wide smile, if we have gummy smile, what the skeletal classification of the patient, and how surgery can influence the skeletal classification to bring them maybe from class 2 or class 3 to as close as possible to class 1. That is possible sometimes with the surgical intervention when we are doing especially both arches. And then we go back now to the CT scan for more detailed evaluation and to pinpoint the location of the implants, the configuration, maybe 4 or 5, tilted for like all on 4 or not, and then the sizes, diameter, and length of the implants. So CT scan evaluation, clinical evaluation, and back for more detailed CT scan evaluation. Because when you do CT scan evaluation before clinical evaluation, you immediately will eliminate certain things so as not to spend too much time on them during the clinical evaluation, because you would know there is a few options the patient is already not candidate for, even without seeing the patient, simply by looking at his CT scan. But now, after the clinical evaluation, we know what he's candidate for, and we confirm that with the CT scan one more time. I mean, for example, if the patient already lost quite a bit of bone due to periodontitis or edentulosum, then obviously he's not candidate for crown and bridge. He's candidate now for hybrid, hopefully, or implant and soft tissue supported prosthesis. So now when you're doing the clinical evaluation, you already eliminated certain options, prosthetic options the patient can have, and that will be more, you have a less time and more accurate and more thorough clinical evaluation. So CT scan, clinical examination, and CT scan again for more detailed evaluation. So we developed a certain protocol to save the doctor time, because you have to do free consultations these days. Patients are shopping around for implants, especially when the treatment is big and it's anywhere from 5,000 to 30,000 per arch. So we have certain protocol that we developed to enable the dentists do very thorough clinical evaluation in a very short time, because again, you're not getting paid for the free consultation time.
I like that. And what CT scan do you use? What do you recommend if someone asks you?
For implant dentistry, most CT scan machines do well. Some of them are not too friendly. Their software is not too friendly, but quality-wise and the image size-wise, most CT scans are just fine for what we need. I like the iCat and I like Prexion. I like those two machines. However, there is a few others that will do just fine for implant surgery.
You're involved with Novadontics.
Yes.
Correct. Explain what Novadontics is.
So I started Novadontics a few months ago. It's a new company, and the goal is to help doctors to perform predictable implant dentistry on one side, and on the other side, help them to save quite a bit of money on the overhead, because we use the collective power, if you will, of Novadontic Smile providers to have very good discounts. In part, the idea of Novadontic started from aviation, and in the aviation world, we have very high margin of safety, and the secret is because pilots use checklists. And unfortunately, in many other professions, there is no checklist. There is no checklist culture, and accordingly, the results are not the successful outcome of what other professions do, not as high as it is in aviation. And I was reading once in an article in Aviation magazine, and I tell that doctors about this when we talk about the importance of checklist. And in the article, it said that if we have in the US, if the airline industry in the US is 99.9% safe, we will get 4 crashes a day. Nobody will step a foot in an airline that has only 99.9% safety margin. So obviously, the safety margin is way beyond 99.9%. Just consider for a second the airline industry did not have any crashes in 7 years. So, I mean, they brought the protocol to extreme science. And the secret is not pilots are smarter than doctors or engineers or any other professions. They simply follow a checklist. And while you do not need checklist in dentistry when you're doing a crown and bridge or a filling, however, in implant dentistry is a different story, especially if the case is big. You have multi-unit case or full arch case. There is roughly 200 checkpoints that you have to do in order not to overlook any detail as you are doing diagnostic, for the patient diagnostic work. So we have an app called Novadent Smile app, and when you join Novadent as a dentist, you become a Novadent Smile provider. Think of this as Invisalign, meaning you offer Invisalign in your office. You have a brochure about Invisalign. You can be a Novadent Smile provider, and you will the Novadent Smile procedure is for patients who are fully edentulous or about to become fully edentulous because of a terminal dentition that they have. And it is very predictable, very safe way to perform full arch implant therapy from the surgical to the prosthetic aspect. And if doctors are interested, they can go to novadontics.com, and there is a link at the bottom of the page, become a Novadontics provider, for more information on this. So it uses the very sophisticated electronic checklist that will give you all the options to choose from, and I think you will do a job like a pro with very little experience. Of course, Novadontics is a complete ecosystem because the California Implant Institute will make sure through certain courses that you are performing the full arch implant reconstruction very safely and in very predictable manner. Many implant company providers are on board. We use exclusively Noble Biocare implants and Geistlich bone grafting products and piezosurgery products, Omnia instruments and disposables. So we use only the absolute highest quality products, proven products available in the market, highest training, and we have the proprietary, if you will, method of combining the CT scan with our checklist protocol to do as predictable, as precise implant therapy as possible for our patients.
You mentioned for CBCT that you use that you like iCat and Prexion. So I went and I retweeted iCat's last tweet, but Prexion hasn't tweeted since 2014, 3 years. And when I go to any of their tweets and hit their links, all the links are dead. I wonder, Prexion still alive and kicking, or what's going on? Do you know?
Very high quality. I love their software. So they've been going through restructuring. I know recently, maybe that's why some links are broken. But it's a terrific machine.
Yeah, I can't find any. Tweets. I can't find any tweets that are working. But I did retweet iCat. They are basically at iCat 3D. So you know the question that all these kids are asking, what implant system do you use? It's very confusing when you walk out of dental school and you go to the ADA convention and you see literally 175 different implant companies telling you theirs is the best. Is this true or false? Tiger Woods could beat you and I in golf playing with any set of clubs, or do you think the clubs have a lot to do with the success? Are there a lot of implant systems that are fine, or do you have a particular favorite? And which one do you teach in your institute?
I do have a favorite, Noble Biocare. I grew up with Noble Biocare. There's many other systems that they do just fine. However, my favorite is Noble Biocare for many reasons. Reason number one, they have the biggest prosthetic options for components to restore implants. They have the best service, and they've been around for a long time, so it's a proven products. Their components do fit very well. So service is very important. Of course, you can find cheaper implants. You have the cheap implants from Israeli to Korean, but then you have the higher class implants, the European or the American, like Zimmer, for example. So my favorite is Noble Biocare, but I do like a couple of other companies that I used in the past. But again, the best service you will get from Noble Biocare and the biggest prosthetic selection is from Noble Biocare. Very innovative. They always improve their products, and they are the industry standard and industry leader. They are the king, and I like to deal with kings.
Okay. Again, I recommend that you read textbooks. You've written 4 textbooks. I can't think of a faster, easier, higher quality, lower cost way to learn endodontics than reading the new Stephen Cohn Pathways to the Pulp. I think it's like 7th edition. I can't think of any faster ways to put textbooks. But right now we're talking to mostly 30 and under. And so the 30 and under crowd is trying to do their first implant. The 40 and 50 and older guys, like my buddies that do all on 4, all of them are over 50. I don't know anyone under 50 doing an all on 4. Have you had many students in your class on the all on 4 class that were under 50?
Yes. We've been getting more and more and more younger dentists who are getting into implant dentistry. There is advantage to start implant dentistry as soon as possible after graduation, after getting dental degree, and because you don't have to shift from the crown and bridge mentality into implant dentistry. So I noticed that it's good to have some experience, but at the same time, when you start implant dentistry right off school, there is also quite a bit of advantage for that. Doctors are very bright, young dentists graduating these days, very motivated and very bright, and I'm very impressed with almost all of them. And as I said, we've been getting younger and younger crowd every year.
And when you say younger, you mean like 41, 42? I mean, I'm
younger.
54.
I mean, graduated 2 months ago from dental school.
In their 20s?
In their 20s, they're taking implant courses. They're getting into the surgical phase of implant dentistry, and they are doing fantastic.
True. I agree with that, but I'm talking about specifically your all-on-4 case. What's the youngest student you've had take the all-on-4?
So any doctor who has around 100 implants under belt, definitely more than qualified to start offering and learning the full mouth reconstruction. All-on-4 is only one of the variation of full mouth reconstruction using dental implants. So anybody with roughly 100 implant experience can definitely start the journey into learning how to do the full mouth implant reconstruction. In a way, you require more knowledge, but skills-wise, you need less skills to do full arch than to do single implant in the aesthetic zone. You are starting with a new slate, like they say, and you can dictate the shape, the shade, the occlusion. You have more control over stuff. When you do prosthesis like a hybrid, you have even control over the soft tissue look, because you have all those perfect papillae in the fabricated with the prosthesis. So in a way, it's easier and less skills required, but it requires more knowledge, of course, to do a full arch. There is no bone grafting involved, so definitely young dentists can get into implant dentistry, and definitely with less experience than you might think, they will be qualified to start learning and offering and performing full arch implant reconstruction.
And that is a huge advantage of all on four. You don't have to do sinus lifts and bone grafting, right?
Exactly. So it's called the graftless solution for patients who are in need, disqualified, of course, but those patients who are candidate for this procedure, they can greatly benefit from it. And again, would like to mention here Noble Biocare because they are the one who started this movement, if you will, and their components are the best for the all-on-4. So even if doctors are happy with another system, I tell them, fine, keep it, but for the all-on-4, you definitely want to use Noble Biocare components. We've been getting great results and much less complications, if any, with the prosthetic components for the all-on-4 from Noble Biocare.
Now, it was invented, wasn't it, by Dr. Pelo Malo out of Lisbon, Portugal?
I'm not sure if he's the one who started in biomechanics books from the 80s. Before I think he became a dentist, we had already lots of sketches showing the vitality, if you will, of the all-on-4 concept of tilted implants up to 30 degrees in multi-unit cases. So Scalak from San Diego, he wasn't a dentist, but I don't know if you heard of him. He was a biomechanic guy. He has all kinds of studies proving the concept of all-on-4.
The biggest argument against all on four is you hear people say all on four is none on three. What do you say to that argument that on all on four, if you lose one of the four, you lose the full arch? So it's all on four, none on three. What would you say to that? You've heard people say that before, haven't you?
That's right. Of course, you have to remove the prosthesis, and you would have to bone graft the area and do another implant to replace the one lost and do new prosthesis. But if things are done right, that chance is extremely small. That's why we try to keep, for example, after the all-on-4, the patient on the temporary fixed prosthesis for as long as possible, so at least 6 months, hopefully, to make sure implants also integrated, no problems with them whatsoever. And now we move to the fabricating the definitive prosthesis for the patient. I mean, you can put all on 5 and none on 3. You can do all on 6 and none on 3. So this is not very valid point because if you do implants for the patient who is candidate, and if the prosthesis done right, if the biomechanics occlusion in particular is also done right for the all-on-4 patients or full arch immediate loading patients.
One of the neat things I love about dentists is most of them, when you survey, say, when you want to know more about a product, what do you want? And 91% of dentists say they want to talk to their peers. Only 9% say they want to talk to the company. And when I search, I have a search on Dentaltown. So we got 250,000 dentists. They've posted 5 million times. And when I type in your name, Louie Al-Faraje, my gosh, it's just nothing but praises about you, the California, like some guy says, has anyone had any recent experiences with this California Implant Institute? Anyone know anything about you? And the next guy says, Dr. Louie is very knowledgeable, informative, inclusive. I feel like I made the right choice to take his classes. Best of all, many of the dentists attending the classes who have taken implant courses somewhere else are finding answers to many questions left unanswered from other classes they've taken in the past. I highly recommend the California Institute and Dr. Louie Al-Faraje to every dentist desires to gain valuable knowledge, blah, 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 blah. I mean, you're mentioned in several threads, and that's a neat thing to do for you dentists. So let's say you have a bonding agent and you're not sure if you're having problems because you have the wrong bonding agent or you don't know how to use it right. All you got to do is go into Dentaltown, hit search, type in your bonding agent, type in whatever question you have, and it's already been asked 1,000 times, because when you have 250,000 dentists who have posted 5 million times, I mean, there's not many questions that are left to be asked. So I just want to tell you that your townies love you.